Now, today marks World Tuberculosis Day. Back on March the 24th, 1882, Dr. Robert Koch announced the discovery of a bacteria responsible for the disease. And decades later, an antibiotic was developed to treat patients. But nonetheless, today, TB is still a major public health issue. Joining me to discuss is Julia Seeger. Julia, thanks for joining us. Welcome to the programme. Now, according to the World Health Organization, tuberculosis is responsible for something like 1.5 million deaths every year. That means it's one of the most lethal infectious diseases in the world.
That's right. And it's present all over the world, but especially in Southeast Asia, followed by the African and Western Pacific region. Now, indeed, it is an infectious disease that most commonly affects the lung, but what people don't know is that it can affect other parts of the bodies like kidneys, spine, and skin. Now, it's caused by a type of bacteria, as you said, called Koch's bacillus, and it spreads through the air when infected people cough or when they sneeze or spit. Now, it's a preventable disease, and it's estimated that 1/4 of the world population has already contracted this bacterium, but only 5 to 10% of infected people will then go on to develop all of the symptoms linked to tuberculosis per se. And there are conditions that can indeed increase the risk of developing TB, like, for instance, diabetes, smoking, of course, malnutrition, but perhaps the most important condition is a weakened immune system. And this is why people who are living with HIV, for instance, have 16 times more are more likely to develop tuberculosis. It's the leading cause of death for people living with HIV. And the reason why is because these two diseases are actually a deadly combination where each one of them is going to accelerate the progression of the other. Now, kids tend to have more serious forms of tuberculosis, like something called tuberculosis meningitis. So here, the best way to prevent that is still the vaccine, the BCG, even though it's still, in many countries, it's not mandatory anymore, like in France, for instance. But the problem with TB is that for a very long time, patients are going to have mild symptoms. So sometimes they're going to spread the disease without knowing it. And some of the most common symptoms of TB, at least in the beginning, it kind of looks like the flu, right? You have prolonged cough, chest pain, severe fatigue, and also fever and night sweats.
Julia, how do we treat TB today?
Well, we actually still use the same antibiotics, the same molecule that we discovered back in 1942. There are several antibiotics on the market for that. But the problem is that these medications, you have to take them for at least 4 to 6 months every day. And if you quit the medication prematurely, then the still living bacteria becomes resistant. And this is when you get to a point called the multi-drug resistant tuberculosis. And this is really the problem, is that then you have to turn to second-line medication that are much more costly and toxic. And here, too, the bacteria can be resistant. And this is really the problem with TB. The huge public issue we're seeing in the world is these forms of drug-resistant tuberculosis. Now, in 2022, just to give you a statistic, 2 people out of 5 who had a multi-drug tuberculosis, only 2 out of 5 were able to have access to a treatment. So this is really where all the efforts have to be focused on really improving the access to care and getting much more investment, especially in countries, in developing countries in the South.
Julia Seeger, thank you very much indeed. And